This is the head trauma module. Falls are the most common way children sustain head trauma, followed by motor vehicle crashes, pedestrian and bicycle accidents, projectiles, and sports-related trauma. Some of the main goals for the treatment and management of head traumas include avoiding hypoxia, hypertension, hyperthermia, seizures, and herniation. Intracranial pressure, or ICP, and cerebral perfusion pressure, or CPP, are used as monitoring parameters in the treatment of traumatic brain injury. Severity is classified using the Glasgow Coma Scale to evaluate neurological status. At Children's of Alabama, hypertonic saline and mannitol are the two agents commonly used to treat closed traumatic head injuries. Hypertonic saline provides an osmotic effect by pulling edematous fluid in the cerebral vasculature, reducing cerebral water content, and preventing or treating elevations in intracranial pressure. Hemodynamically, hypertonic saline increases cardiac output, organ perfusion, mean arterial pressure by facilitating movement of fluid from the interstitial and intracellular compartments to the intravascular compartment, and central perfusion pressure due to systemic intravascular volume expansion. At Children's, 3% hypertonic saline should be initiated at a 5 milliliter per kilogram IV bolus over 15 to 30 minutes, followed by a continuous infusion of 0.1 to 1 milliliter per kilogram per hour. Administration of hypertonic saline should be through a central venous line. Hypertonic saline can be found in the emergency department trauma Pyxis machines and the pharmacy code bag. Mannitol is the osmotic diuretic of choice for the treatment of intracranial hypertension and head injuries. Mannitol reduces blood viscosity, which transiently increases cerebral blood flow and oxygen transport. This leads to a reduction of cerebral blood volume and intracranial pressure. Mannitol can also reduce intracranial pressure by withdrawing water from the brain parenchyma. Mannitol may lower cerebral perfusion pressure due to reductions in mean arterial pressure caused by the diuretic effect. Mannitol can be found in the emergency code bag. Prior to the administration, always inspect the mannitol vial or bag for crystallization. If crystals are present, redissolve by warming the solution. Use a filter needle to draw mannitol out of the vial and filter when administering to patients. Do not administer with blood products. This concludes the module on head trauma. You may review this again at any time.